everyone, and we welcome you to another opportunity to have healthy conversations with Dr. Gigi. I'm Reverend Dr. Kendrick Curry, pastor of the Pennsylvania Avenue Baptist Church. I'm excited and delighted that you're here with us, and we are just going to have a great time discussing staying mentally fit during the COVID-19 pandemic. And we are just excited about who we have with us this evening. We have none other than Dr. Gigi L. Bume with us today, as well as Tariq Walton from Starting With Today, as well as Dr. Rufus Tony Spann, who is the Chief Clinical Officer at Henry Health. And again, I'm Kendrick Curry. And forgive me, Dr. Gigi, I never mess up your name.
That's okay. That's okay.
But we're going to have fun today because this is an
Reverend.
exciting topic, and I'm excited, probably too excited. I'm peacock proud and hyena happy. How about that? And so what we would like to do is having just an opportunity, Dr. Gigi, to have you provide some opening comments with us so that we can kick this webinar off in grand style.
Well, thank you, Reverend Curry, and it is such a pleasure to partner with the Pennsylvania Avenue Baptist Church. And I know that it's a lot more than just your congregation that's listening in. We have also, through the Rodham Institute, which, as you know, is at the GW Medical School and is dedicated to improving health equity, we've invited other people to join. So I like to start off by just giving a very brief overview and update of COVID-19 and what we know right now about it. Remember that this may change as we get more information. The same issues are staying constant in terms of physical distancing, washing your hands, wearing your mask, staying at home. But some very distressing news out of the District of Columbia: 81% of the deaths have actually occurred in Black people. And we are seeing this in our hospitals, and in Southeast at United Medical Center, which is one of the Rodham Institute's anchor institutions, they are really getting the brunt of that. So for us, what we're doing is trying to get meals out to United Medical Center staff. We're also trying to get meals to the clinics that are taking care of women who are pregnant, for example, so that there's a lot of attention to getting food to the first, the physicians and all, but it's more on the northwest side of DC. We need to get it where it's actually needed, which is on the southeast side. The second thing has been the excitement of this medication that you probably heard about. It was a medicine that Dr. Fauci actually first used for Ebola victims. And it is hopeful. It is only used right now in the hospital setting, in the ICU setting. And it reduces the death rate by something like 30%. But just like anything else, we have to get more information. It's got side effects. It is a hopeful sign. Finally, sort of as a lead into this discussion, one of the things that's causing a lot of people anxiety is the fact that although our testing has gotten a lot better, we do have a test that works now. We don't have a test that actually can tell us if we've had the virus. And so there are lots of tests that are being developed, but they're not really reliable because there's a percentage of them that will be positive even if you've never had COVID, and that will be negative even if you've had it in the past. So stay tuned for that. We're not ready for prime time. But, as one of the consequences of COVID, especially in communities of color and specifically in wards 7 and 8, mental health is really taking a big hit. As somebody who sees patients, I cannot tell you how many of my patients have had to start on medications for severe anxiety, especially anxiety, I would say. People are having difficulty sleeping, depression. People are already struggling with those issues. And then you put a layer of can't see your family. For people who've had deaths, they can't even go to a funeral and can't grieve. Don't know whether you're going to have a job or not. Maybe you've lost a job. Maybe you can't find food. What are the kids going to do? It's quite a bit. And before we turn things over to our panelists, when we first started the Rodham Institute 7 years ago, the very first thing that we did is we had Ms. Khadija Tribble, who was a community health worker at the time, and we commissioned her to do a study, an environmental scan of what the health priorities of residents of Ward 7 and 8. Mental health was number one. And that's why at the Rodham Institute, we've really made sure that mental health is infused in all of our activities, and also making sure that we include it, because it's, you're one person. It's not just your physical side and your mental health or emotional. We're one. We're one. And of course, you, Dr. Reverend Curry, being a man of God in the church, that probably better than any doctor, right? We're not separated out. So I'm just delighted that our new partners from Henry Health are going to be talking about these issues, and about where to seek treatment. Please, please remember that you can go to our website, the Rodham Institute, and click onto COVID, and we've got our resources. We'll make sure that Henry Health is added. And then I'm going to have to excuse myself because the mayor appointed me to the new task force to reopen DC. And I have to tell you, I'm going to do my best to represent and to make sure that the needs of Ward 7 and 8 are being met. But I want to get more people from Ward 7 and 8, such as you, Dr. Curry, and others, to actually be on the task force, because we need to make sure that the voice of the people is actually represented, not just heard, but actually at the table and represented. So with that, I'm going to say, I'm so sorry I'm missing this this wonderful webinar. I'm going to catch it on the recording. And thank you so much, and be well. Can't hear you.
We are just so excited that you are on the task force so far, and we know that it is a stellar team that's been put together indeed. But the voices of those who are on the margins and those who are really find themselves dealing with
Yes.
the heat of the day and the brunt of all that
Yes.
is not so good in DC, we find that that voice is very much needed, and we can no longer stand by and have
Absolutely.
muted voices. So I thank you
Absolutely.
so very much
Absolutely.
for what your
Absolutely.
efforts, and we look forward to hearing more about that.
I
So thank you, and
You're
we'll miss you
welcome.
today, but you're
I
doing good
will, and
work
I'm at your
for
service
us.
always.
All
I'm
right.
a
Thank
born
you.
again Washington girl, Washingtonian.
That's right. That's right. Thank you. Thank you.
You're
Thank you.
welcome. Bye-bye. Bye-bye.
Well, friends, we just are so excited for our discussion this evening because we have opportunity to hear from experts that deal in the field of mental health, and those that expand the length and the breadth of the community to really touch lives and transform them. And so today we're going to hear from an outstanding crew that I've already named, and it will be something where you have the privilege and opportunity to ask your questions and really go in deep. We want to do a deep dive in and around what it means to stay physically fit and actually mentally fit during this time of this COVID pandemic, something we didn't foresee, we didn't anticipate, but is nevertheless upon us. And hopefully we'll get not only that information about being mentally fit, but also we'll look at what we need to do in the future in the post-pandemic era. So without further ado, we will just welcome Mr. Tariq Walton, who is with Starting With Today Foundation. And we are just excited that he's here, and we just welcome you on, Brother Tariq. We just are so glad you're here, and we would like to hear from you about what your organization really does and how it impacts the lives of people in all sorts of neighborhoods, especially those who are in neighborhoods which are housed the most vulnerable.
Thank you for having me on here today, Dr. Kerr. Really appreciate it. I also wanted to introduce Charlene Anderson. She is the director of Starting With Today, and she's going to actually present the information about the foundation.
All right, looking forward to it.
Awesome. Do you have the slides, Reverend Curry?
Yes, I do.
Okay, awesome. So Starting With Today is organization, nonprofit organization, and we service Southeast DC, Ward 7 and 8 in Prince George's County. We focus on 3 pillars. One is professional development, financial wellness, and mental health. And we think those resources, those pillars are a holistic approach to solving ills in our community, creating economic freedom, empowering people, and giving adults tools that they need. We know there are a lot of service organizations servicing kids in these areas, but we also feel like parents and adults need second opportunities, third, fourth, fifth opportunities to really launch forward on their dreams. And you can't do that if you're not in the space, mental space, to excel and having that support system. So that's what we do. We create community. We can create safe spaces. We've done this primarily with the Shape Up. We can go to the next slide, where we, Tariq Walton leads the Shape Up Talks at Lee's Barbershop that is in Ward 7 in Washington, D.C. And what we do is we bring mental health, Black mental health, specifically to the Black community. Black men, all are welcome, but these conversations are catered for Black men in particularly. And we have conversations, that are real, and so we can expand on that, from everything from emotional wellness to grief. We did one after the loss of Kobe Bryant around grief, and giving space for Black men to not have all the questions or the answers, and really we all trying to figure it out ourselves. So in that's community. We partner with small businesses in that as well. And we do bring yoga to parents. We do gardening and painting, where things that we consider leisure and sometimes luxuries that aren't always available to our community, that are also important to our overall health, as Dr. Gigi had expanded on. You can go to the next slide. And so we have 3 branches of programs where we do both mental health, financial literacy, and career development. And that's parent engagement programs, where we go into the school partnering with nonprofits that are servicing kids, and we provide programming for the parents. We have the Shape Up Barbershop Talks, where again, we go into the barbershops, as you can see there, and we have real conversations in the middle of Saturday morning. And it is amazing to see that we've been doing that since May 2018. So we're coming up on 2 years of that. And then we also do direct programming. We brought programming to Howard University students around credit and understanding budgets. And then also, again, the parent engagement program. We've also expanded the Shape Up to online, where we have a podcast as well. And so that's available on all our platforms, SoundCloud, YouTube. And since COVID has hit, we've begun the Instagram Live series, where we're bringing program around COVID and mental health and financial literacy and career development to the Instagram Live stories and YouTube. So those are expanding as we speak, and we'll have a full schedule for May coming up.
All right. Thank you so very much. And we have your information that's right there. And I hope that you will stick around so that we'll be able to have some dialogue after our next presenter, because as we're dealing with mental health, we see that you are doing some exciting work in the heart of the community, where you touch people. And that's something, because people make it happen, and you're building bridges and connecting people. So thank you very much, Ms. Anderson, and certainly Mr. Walton, for your presentation tonight. And please stick around for our further discussion that we're going to have. And I'm just excited now to begin to move forward with our next presenter, who is none other than Dr. Rufus Tony Shaw from Henry Health.
Thank you, Reverend Dr. Kendra Curry. I want to say it is a pleasure to be on here this evening with everybody as we get started. I'm going to do a screen share so that we can jump into one, so I can show you the slides, and then kind of get into what is Henry Health, and then this will maybe prep the conversation for the panel. So looks like everybody can see my screen. And so I'm just going to start off with who we are and what's our mission. So Henry Health, we came together as a collective, and really coming together and figuring out, how do we help Black men first in dealing with what we feel like is what has been a disservice to the life of the Black man. And so when we think about changing that and looking from a strength-based and empowerment approach, we look at providing culturally sensitive care and support and mental health services to ensure Black men can show up whole, operate with joy, and live with power. And we believe like this is so meaningful starting here with Black men, because we know that with the inequities, historical trauma, continuous trauma, as well as when we think about the life disparities that go along with Black men, we feel like if we start this with Black men and get into the challenges that go along with that, we can take these same successes and wins that we have and go into other populations and communities. So what do we do? So at Henry Health, we have a couple of parts of who we are in our wheelhouse, but we're going to start with teletherapy, and that's a big part of what we can offer right now and offer to our community. So I, as Chief Clinical Officer and working with our therapists, I always talk about culture first. And when I say culture first, I mean at the premise and the core of who we are at Henry Health, we look and get right to the understanding of culture. We find that when we do that, we get into the narrative of who you are. So that could be male, female, that could be Black, Asian. We feel that as we get to the essence of who you are, when you step into that room, either brick and mortar or teletherapy, our therapists are trained to make sure that we get to know who you are and respect that identity. We don't want any part of you left out of the room. We are currently available in DC, Maryland, and Virginia. And so as we are only serving this area right now, doesn't mean that we're not expanding. We want to be nationwide and worldwide, and making sure that we are providing culturally relevant, culturally intentional, culturally responsive care when it comes to teletherapy. And so now that we think about what does that mean, because it sounds really good to say culture first, and what does that look like for our therapists? Our therapists are trained in the understanding of, when I say responsive, that means that if I say something about my narrative, or Dr. Reverend Curry says something about his narrative, the therapist is trained into getting into asking about what did it mean to be a Black reverend, or what does it mean to be a Black resident of DC currently with COVID-19 and the experiences that are happening within our world as we see the disparities on healthcare equity with Black people. And so just getting into those nuances, we're realizing that the social political issues that come along with that, we get to the heart of that, and we're not leaving that out. So we do have free consultations that are available. Our therapists are ready and willing to do a consultation. If you have something that you just want to ask or get an understanding, maybe that's for a loved one, maybe that's for yourself, we are willing and ready to do that. Self-care support, we do have articles out right now. Please go to our website, which is www.henry-health.com. If you go to our website, you will see content. We have content that ranges from what it means to be a parenting, co-parenting, or what does it mean just to unplug during this time. And unplugging really can be helpful for dealing with anxiety. And then that Kevin Dedner, our CEO, also has content up there that you may want to read. So coming soon, this is where we're going to stay for a little bit. Coming soon, we do have an app that's coming out. And with our app, we're starting to launch one of our communities. So our biggest community that we're starting with is Men Thrive. It will be a digital podcast that has daily Thrive call, talking about what it is to be present as a Black man, being empowered, showing up whole. Jeff Johnson will be really taking this forward. So if you want to check this out or register with us, go to menthrive.com. But what we see on the left-hand side is an example of what you're going to get when you get to our app. And when it gets here, you're going to be able to do daily affirmations. You're going to be able to look into podcasts, content material. If you want to go into therapy, you can sign up for therapy. If you want to get a baseline assessment, you get that, as well as meditations. So we really want our app to be holistic, and where you get that self-care mastery, as well as you're going to get that teletherapy. And the first community, as I was saying, is going to be our Men Thrive community. So I'm excited about that. And then last but not least, we are here to help. We've always been in service. We've been in service going on about 2 years now, and our app will be coming out in the next couple of months. But before then, if you want to just go to henry-health.com, please check us out. Anybody can check us out. Anybody can come and receive services, although we are working first with Black men. Also, if you want to look at some of our handles, we do have @Henry Health app, and also hello@henry-health.com. That last one is where if you want to speak to me, you want to speak to practice management, maybe the CEO, you can reach out to us at hello@henry-health.com at any time. Last thing is just that we have resources, we have wellness calls. If anybody, a part of the congregation or just nationwide, wants to get a free wellness call, we would work with you on what it is to be well. We rate your wellness. We'll talk about what are some techniques you're doing and how we can improve that. And that's no cost. That's free of what we're doing as an agency. You can do it tonight if you want to start that. Teletherapy, we have a reduced cost right now, so please check that out. Self-care library is that content that we have online. And last but not least, we have this hashtag coping with COVID-19. That is a series that we're doing with webinars. They will be posted online. We've completed that. And we have an infographic for those that want to look at the infographic. But that's just a quick snapshot on what we're doing. And I just want to introduce that. And then we'll still answer a lot more questions during the panel.
That's incredible. Is awesome indeed, and we are just excited about what both starting with today as well as Henry Health, what you're really doing. And what we like to do is start off with the couple of questions, and I'll give some underhand pitches now, some of the easy questions, and I hope our viewers will get into some of the more difficult and challenging questions that sometimes folk that are not in community may not want to ask. And in me saying this, I want to ensure you that this is safe space.
Mm-hmm.
We want to be able to create a safe environment. It's as we go deeper, we have the clinical experts that are on the line, but this is a safe space. There are no dumb questions. We're here to really provide a community, not only this community that's really on the webinar, but literally those who in Facebook space and who will see this around the world. We really want to be available to you to help out and deal with this COVID-19 pandemic and how it impacts mental health. I will just start by asking to anyone who would like to start, what really inspired you to start your business, first of all, and to deal with mental health as part of that business model?
I didn't know if maybe Charlene may want to go first. If not,
Charlene?
I can go ahead. Absolutely. I think growing up in, Dallas, Texas, in all Black neighborhood, there was a lot of things that were happening that we didn't have explanations for. There were, there's aunts and there's uncles that
Yes.
have dealt with mental health for a long time, and we didn't really have the language for it. And to see that, and then also to see the disparities between someone that may not, a child in school that did not have a great attention span versus someone who did, and how easily those gaps can broaden as you expand. When I went to Howard and just learned more about Black psychology and the role that oppression plays on that, I knew that a lot of even my own stagnation at times was this added layer of racism and oppression. And it's hard to move forward without, even with a great support system that I did have, gratefully, great parents and great community. Even with that, there are still tools that I knew I needed. And then how much more so for other people in our community, where we're talking about, okay, you want to get this great job, or you want to, establish a savings for your kids, and you're barely, making it yourself. Even with this pandemic, just exposing all those things Dr. Gigi had expanded on. It's really hard to do the basic stuff with the weight of your world on there. So I just knew we couldn't just throw a Band-Aid on it and say, hey, we want to help you reach economic freedom without taking into account our mental health as individuals, and then also as a community, because we can see the effects of not having spaces to heal, not having spaces to search and find answers and self-discovery. It's a luxury, right? Because we're just in survival mode so often. So how do we create those? So that was my mission.
Well, I thank you for that, and being a Dallas native myself in the area of Oak Cliff, So I definitely, without question, understand what you're talking about. So we can share more on that at another time. But Dr. Spann, please share with us what was the inspiration for not only Henry Health, but I want you to also pivot and also go and provide a sense of distinction between mental health and mental illness.
Okay. Well, I'd like to talk about how Henry Health did come about. And the great thing about it is that it came through our CEO, Kevin Dedner, looking for support and help. And through him having to go through several different therapists that just didn't really get him, he came to me and he found that there was something great about me. And I mean, that's good because I feel like there's something great about me. But at the same time, I think is that there was something different in the technique that I was using. And it was something that I got mentored in, and really from Hopkins and a professor that's there, that she's been really great in sharing her tech with me and even to the world. And so I mentioned that is that Kevin was like, I would like for us to create this opportunity for Black men to get this experience because they're hurting. And, we know that life expectancy is lower than others. And he's thinking as a public health person, which he is, how do we change that narrative? How do we do some culture shifting in that? And so that really was the premise. And that started right around 2017 at the end of the year. And so we've been in the thick of it, really just trying to figure out how to make that work. It's a chicken and egg situation. You have to do culture shifting because we know with Black men, treatment seeking behavior is not the highest. It's not high in men in general. Generally it's the females, women's pushing us in there to get stuff done, which I love because sisters got our back. But at the same time, it's like, well, how do we change that for Black men? And so that's really been our premise. We realize that it needs to be content that shows that, hey, this is a space that you should come into, or also creating a therapy practice or a clinical practice, which we have, that says, hey, we are having culture first. We want you to feel comfortable in this space, and we want you to know this space is for you. And right now, a lot of therapists, a lot of mental health agencies are like, we need to get more people of color. We need to get more Black people into this space. And my question as a clinician, well, how are you doing that? How are you showing them that this space is for them? Because typically when you see that, you see non-people of color, you see predominantly more white people in those spaces. And so a Black person would be like, well, I don't see my face in that space. I don't see messages that say like, this is for me. And so that's where Henry Health is like, no, we're not going to do that. We're going to be very intentional about showing the message. We're going to be very intentional about giving empowerment because we know we have to do culture shifting. And so that's really been our premise, culture first, culture shifting, and really getting people to get into space where they're doing total wellness, looking at self-care support and mental health services. So now getting into mental illness and mental health. So if we think about mental health in itself is kind of like just that broader term, like what's going on with your mental health? And I'll ask that all the time. And so that could be social, emotional, like how are you doing with that, with maybe anxiety or being connected to people? And then also thinking about just how are you maintaining a sense of good mental health with that? And so that would be maybe one wheelhouse of that. And so many things float into that area. When I think about a mental illness, I'm thinking more about, okay, now we're seeing like there's something that may be undiagnosed that may need to be diagnosed. We're actually seeing something that has a level of chronicity, frequency, and duration. And so in just thinking about when somebody says chronicity, frequency, duration, I'm asking, well, how long has this been happening? How has this impacted your life and your world? When it does happen, what is the intensity of it? And so when I start to see that, I'm like, there may be something here in your world or your life that's causing you to feel, act, and be different than maybe what you want. So that's impacting your wellness. That's impacting how you think, act, and behave. Now, I have to be careful because I know what we think is normalized, maybe normalized more for one community and maybe not for the Black community. So that's where I have to take a lot of in like culture and identity and wishing narrative. But if something's like, hey, it's anxiety, it truly is anxiety, or it's truly a compulsive disorder, or it's truly some kind of personality disorder, that is where we can say, well, that may fall in the term of illness, although I don't use that term so strongly, but at the same time, that could be more of the term that would be used with illness, as we're seeing there's something that needs to be diagnosed. But I will leave on this note because I'm more about empowerment. Once you know the diagnosis, then you can get treatment. Right. And that's what we really want.
I think that's something we need to just continually reemphasize, because there's oftentimes the stigma and fear with regard to the Black community as it relates to just getting a diagnosis in the first place. And so thank you for sharing. I like to sort of ask the same question of Charlene and Tariq, and then provide us any insight with regard to your perspectives on particularly mental health.
Great job with that, Dr. Span. Everything you said was right on point. I was with you the entire way. The thing that I wanted to add, especially from the cultural perspective, and this is something we address in the barbershops too, is recognizing that mental health challenges, and we usually try to get away from saying mental health illnesses and say mental health challenges. We say illness is a certain feeling people have about that, so we say challenges. But a lot of mental health challenges that people in our community suffer from are intergenerational. You're seeing it pass on from mother to child, father to child, generation after generation, and recognizing that what you're feeling is not something that you're going through by yourself. There are probably other people in your family who are suffering from the same things. We're just not talking about it. You can go, you always had that one uncle that stayed up, up in the attic that no one really, talks about, and, he was a special, but no one really talks about, okay, well, maybe he was suffering from bipolar disorder or, major anxiety, major depressive disorder. Any of these different issues that we really did talk about, we might have had the resources to diagnose them, but they were always there. They've always been present. If you look at, the way that people self-medicate using marijuana, using alcohol, and looking at how many generations that goes back, seeing that may be a way that they've been dealing with undiagnosed depression or anxiety, generation again. And so just seeing that, if you have a discussion with your family, you'll realize that there are things that you're experiencing that other people in your family have been experiencing, again, for generations. And I think that's where the conversation needs to begin. We suffer oftentimes in silence and without much guidance. We have to talk to our family. We have to be feel safe to talk to our family about these things. We have to have the chance to find out, we may not realize that we've been suffering with this our entire lives, but our parents may be able to look at us and say, "Oh yeah, you've been going through this since you were a kid. Weren't really sure what was going on, but yeah, the thing that you're talking about right now, yeah, you've been doing this since you were a child." Having that perspective, so that as we move forward and try to get help, we know our history. One thing for me as a clinician, we do what's called genograms. Genogram is kind of looking at your entire family history, not just the branches of your family, who's who, but understanding the relationships, understanding the mental health challenges that have plagued your family for years and generations, and seeing those connections so that you realize, oh, I remember being on a panel one time, and a couple of people on there were suffering from schizophrenia, have mild forms of schizophrenia, and come to find out as they began to talk to the family that they had a cousin, they had an aunt, they had an uncle, they had a grandparent that suffered from the same disorder. And so these discussions we have to have. Without that, again, it's really hard to figure out how to navigate what's really going on with us before we seek out our therapist. But as a therapist, I want to find these things out. So you have to find out before we actually sit down.
Yeah. I thank you for sharing that, because dialogue is definitely key. And you mentioned I'm very big on genograms, even in theology. In order to help somebody from a spiritual standpoint, it's always good to go back and know what has happened in generations before them.
Right.
I've personally done genograms, and it led to some painful conversations that you had to deal with mama about grandmama and granddaddy and great granddaddy and all, etc. So when you go back and start to unpack that is something that becomes very helpful. But what do you do when no one wants to talk about this type of stuff? How do you? I know for me, there are a lot of things that I had to come to understand, but it was only after I initiated the conversation.
And that's where it begins. You have to actually
Somebody
open
has to
up.
be an initiator. Yes.
Right. Yeah. That's
So
where it begins.
So what can we tell the audience now about being initiators, and where do they start with regard to having conversations? I'll take any of the panelists.
Well, I generally say you can start on the fringes of the conversation. You know, sometimes people want to go hardcore pain. It's like, I'm just going to tell you exactly what I feel like is wrong with you. And it's like, well, that may be a little too hard for somebody.
Yeah.
What you can do is start on the fringes and you just kind of have some open conversations. And I think a great word that we're using now is wellness. And you can say, you know, let's talk about wellness. What does that mean for me? And kind of saying, well, like, I'm thinking about my wellness lately, and then having that open conversation, because I think sometimes people feel like there's trigger words, and even to change that term, and just saying like there's certain buzzwords that kind of shake people up. And so I think when we think about what that means for them, we don't want them to be closed off, right? Because when you start having a conversation, people start getting closed off, you can't reach them. And I think starting on fringes with conversations, talking about wellness, talking about maybe even like how you're feeling, and it starts to open it up. And then as you get away from the fringes, then you start talking more about the epicenter and what's going on, and asking, well, how are you feeling? Well, I noticed the other day, or this is what's been coming up and this is impacting us, or this is impacting us as Black people, or I've just seen this kind of thing going on with you for years. But I think ultimately starting in a place where you can kind of get somebody to be receptive to what you're trying to talk about, staying on the fringes, and maybe even staying on the area of like wellness. And then you can kind of move to a different conversation.
Okay. I like that model. That seems to be very helpful for us in terms of moving forward. Let's take a couple of questions from those who are in the audience. One says, what can you say to someone who rejects mental health support because they fear it automatically means they will end up being medicated? So, Tariq, if you want to start, Mr. Walton.
Okay, people have a lot of fears, particularly in our community, around mental health. There's a whole historical reason for that when it comes to just dealing with health in general. Particularly with mental health, though, people are really afraid to move into that realm because they're not really sure what it means. So to get past that fear, you have to ask questions. You have to ask questions to people who are aware of the field. Talk to people who've been through it. Whether as a counselor or as a client, you have to be educated on it. There's no way. It's like buying a car. You're not going to go up to a car and just pick out any car. No, you can do your research on it. So you need to do some research in order to soothe some of your fears. Your fears are valid. Your fears are valid, but there are always answers to those questions. Are you fearful that your information will get out there? Are you fearful that you'll be put onto some kind of medication? Are you fearful that your job will find out? All these fears are valid, but only way you can actually get better in terms of dealing with what you're going through is to ask questions and is to get help. If you do have to get on medication, you have to accept that. And some of us will function better once we have the medication. That is a valid fear, but it may be exactly what you need. And so a level of acceptance has to be formed within you as an individual. But it all starts with the education part, being educated about what this process is.
Dr. Span, anything to add?
No, and I love what Tyreek was saying. And, what I do is a lot of normalizing. And, sometimes I try not to generalize or normalize to a point where somebody's like, well, I'm not everybody, which is true. But I do try to say, like, I start maybe more with the physical, because we see how medication has helped with maybe managing diabetes or managing some other kind of illness. And I say that, one, education, like Tyreek said, we want to be educated about what this feels like and looks like. We don't want you to feel not yourself. And I think that's where a lot of people are concerned, or how we've been treating as a Black diaspora and being tested on and given all this medication. And so there's always this leery point on, like, are they trying to use us as guinea pigs? And I appreciate a healthy sense of skepticism, because I don't want anybody to feel like you need to be running into using something. But I try to say, you know what, if we're thinking about what this could mean for you, if it means you living a healthy lifestyle or wellness or your best life, or being able to function in a way that you want to on a normal basis, well, let's talk about what that means. But I try to normalize and help people to realize that there are a lot of people out here, and a lot of times we don't know. There's a lot of people out here on medication, and we don't know that, and they keep that stuff to themselves. You can also be on medication and keep that to yourself, because it's not everybody's business. But if it helps you to live your best day, your best life, and you're on it, continue to do that or think about that so that you can keep that to yourself, but at the same time be healthy.
Yeah, I thank you for that. I really thank you for that because you all are setting a paradigm, indeed providing models and ways and means and how to's of making this thing accessible. And I'm grateful because you are so helping us today make life and make us deal with situations that are very difficult, because some of them are quite frankly taboo, but you are enabling us to go forward in with a model, with a plan. And I'm grateful for your sharing. Can either of you speak to what the impact of COVID-19 has been on the overall mental health state, particularly in communities that are underserved, Black and Brown? Who'd like to
Um,
speak, Tariq?
it's the, I don't even know where to begin. There's so many different ways to look at this. There's so many different ways to look at this. We look at people who are in underserved communities. You'll find that there are a lot of people who are either essential workers or people who
Mhm.
don't have a savings. So they have to work whatever way they can. So they're constantly putting themselves in danger, as well as maybe the people who live in their household with them. So there's a lot of anxiety around underemployment, unemployment, not being able to pay their bills, but then also on the health side, worrying about if they're going out here to work to make to bring something home, that they could be potentially not just exposing themselves, but the family members and loved ones as well. You know, so that's that constant fear feeds the anxiety about leaving their household and what that means. So you have rampant anxiety around that. But then those people who are privileged enough to be able to work from home, they have their own anxiety about leaving the house. You know, when they have to leave the house, and they may not have to do it on a daily basis, but they do have to leave eventually to get things. Um, so there's so much anxiety around that part of it. Also, you have pockets of anxiety and depression popping up with people just being home and not having the ability to get out and just see things and do things and interact with people. That can be very, very hard, especially if you're already dealing with some mental health challenges. If you're already suffering from generalized anxiety disorder or major depressive disorders, you already are predisposed to have a deeper sense of depression or anxiety. And so, you know, this is one of those occasions where you need to be able to reach out. If you're working with therapists, you need to make sure that you're connecting with therapists as often as possible. But yeah, yes, that's one thing you're definitely seeing as a result of this crisis that we're going through right now.
Dr. Span?
Yeah, and I just wanted to add, and thank you, Tyler, for everything that you're saying. It also just speaks to all the disparities that were already there, that were either covered up by things of capitalism, covered up by other issues that nobody was trying to pay attention to. And I think as a Black diaspora, you know, me and my mom were talking about this the other day, and I think it's a term that other people say, you know, when the nation or the world gets the cold, we get the flu, you know, or nation or world gets the cold, we get pneumonia. And it's just because of all the other issues that go along with it. It's very nuanced to talk about the healthcare system. And then once you get to the hospital, the treatment that you get at the hospital, or thinking about insurance and having insurance because certain jobs don't have the insurance. And as we talk about for those that have to be either essential or work because there's no other choice, even if you are sick, you know, taking a day off or just not being at the job means that you don't get paid. And so there's so many issues and nuances that are for people of color, just people in general that have to work. But then talking about the stress and the anxiety that comes along with that, with job loss and layoffs, and then talking about what it means to bring that back to the family. And so it's very circular and circular. And I think what we really are looking at is all the inequities that were already there. And now we're being faced with them. My hopes is that while we are being faced with them and they're in our face, that we are pushing for the agenda, that we're making sure that what are the inequities that were there and that we don't allow for them to continue. And that's where policies and pushing the public agenda and saying that we're not going to be okay with that. That's the empowerment behind that.
And any special words that you would add for the elderly of the population, because the elderly are challenged in, not only are you may be Black or brown, but you also older and your body may be more susceptible to certain things. And so any words of wisdom that you could share in that regard with the impact of COVID-19 and mental health.
Yeah. Well, I'd like to say I appreciate you and I love you for those. That is one I want to start off with, that you have definitely been here as trailblazers and getting us to the point that we're at as people of color, as Black people, as a community.
Absolutely.
So I think for me, when I think about our elderly and our loved ones, I'm also hoping that you're able to call on other family members and the younger folk, as we would say in my family, call on the younger folk, and having people go grocery shop for you, have people that they are helping you. And I know this is not everybody's situation, but there are opportunities where some of the stores do have the earlier hours and you're able to get your grocery shopping done, or there's ways of maybe even calling on somebody to get support. But we do know that because of the changes in our body, changes in the immune system, and even your own personal mental and emotional health, that there are challenges. What I would say to this, even if you cannot, and this, hopefully this makes sense, even if you cannot get online, or if you know an elderly person that cannot get online, see if they at least have a cell phone or a telephone, give them a call, maybe even set up an appointment with a therapist. They do telephone calls. They can talk to them over the phone, like we have wellness calls. Try to get very innovative and creative to making sure that somebody's checking on them. And it doesn't have to be coming to the house, but something that just keeps the emotional piece up. And that's the same for the elderly, like in your own body. Make sure that you're doing things that help with your health and wellness, and making sure that you stay physically fit. Make sure that you keep yourself from harm with the virus that's out there.
Yeah, yeah. Thank you so much for your sharing. I want to take a few of the questions that are coming in from those who are in the audience. And one that we will take now is, when you can't work from home, what do you do to live and survive? That was one question that has come in. And I guess that's a very real one. Um, and I think Tariq, you spoke about it when you spoke about the essential persons that are in the Black and Brown community. Any wisdom that either of you might give with regard to, what is someone to do?
I'll,
Um,
I'll take this one because
Thank you, Ms. Anderson.
we recently did a starting with today Instagram story around this, and we brought in a physician, Dr. Tiffany Turner, who is on the front lines at the hospitals about what's happening. And so the things that we know that Dr. Gigi kind of spoke on at the beginning is, again, wearing masks. Everybody needs to be wearing masks when they go out. And you're susceptible if you have on a mask and someone else doesn't have on a mask. So make sure that you're staying away from people who don't have a mask on for your own protection. Also, again, we wash your hands. When you come in, you really want to make sure that you're sanitizing everything that you touch. Again, washing your hands once you come in for 20 seconds at least. Just regular soap. If you don't have soap and water while you're out, making sure that you have Lysol on you. And you're wiping down your cars, you're wiping down your keys, wiping down your cell phone very often are things that we can do to, take the precautions that we know at this point that are helping to curb outbreaks. So, and then again, just that social distancing piece, which is really hard. And there's been a lot of videos about people, especially in our community, that as it warms up, that we're having barbecues and parties and all that. And it's really hard to understand that we cannot do it at this time. And to get creative, I saw a video today of Detroit where the neighbors were, at each other's houses outside their own houses. So they were social distancing, but they were doing like second line outside. So it's a great way to, have some community, to have fun. And then also make sure you're staying, at least 6 feet apart. And that's the bare minimum. So that's what we know how far the virus can travel at this time. but it's, they have said that it can be up to 10 feet. So just stay far away from people, and do the best you can to try to disinfect as often as you can.
Well, thank you so
And for
very
those people who don't have the chance, or who can't work right now, or are underemployed, I would say this is not a time to be prideful. This is a time to reach out and ask for help. This I'm a historian by trade, going way back, way before I was this. I was a social studies teacher a long time ago. So I always put things into historical perspective. But when you look at the bread lines of the Great Depression and the super lines and everything, recognizing that people who once had, millions of dollars and who lost that, they were now, leading the bread lines. They were there too. We know that, we can be very prideful. We know that we don't want to put our business in the streets, but this is not the time for that. If you need help, there are places where you can get help. There are food pantries. There are, companies who are doing things to help people in any way possible. Unemployment, we see keep skyrocketing. I think there was a new report that came out today at 3.8 million people applied for unemployment in the past week. If you need help, don't just sit there at your house waiting for somebody to come knock on your door. Reach out. If you have to file for unemployment, it's okay. That's why it's there. Apply for it. If you have to get, food through a food pantry or any other kind of help, go ahead and do it. Don't be ashamed to reach out and get that help that you need.
Okay, thank you for that. Let's go to a couple of other questions. I want to be mindful of our audience, and so I'll try to arrange them the best way I can. But they're just coming in because folk are enjoying what they're hearing. One question says, "Do you believe that medication used for depression is not a one size fits all?"
Yeah. Unfortunately, there is no medication that is one size fits all. We don't have that per se technology. They try to get down to like the DNA and like who you are, your structure, and build up medication from there. But generally, when medication pharmacists or pharmaceutical companies, when they create the medication, it is so generalized that it may work different in me because of my body makeup and historical background, that may be different in a white female, that may be different in a Latin or Latinx. And so when you take medication, you really do have to see what does that mean for how it's going to affect you, the milligrams, and also like your eating diet and everything else that comes along. So there's so many different factors. Mm-hmm. And last but not least, what I'll say to that, and then still passing it off, is that as a therapist, pretty much coming out of a counseling realm, a clinical realm, I never recommend that you just do medication and not have therapy, or that you just do medication and not have other support systems. Mm-hmm. That's just because whatever you are either depressed about, sad about, or anxious about, the medication is there maybe to help within the brain and kind of getting you to a stabilized point. But for me as a clinician, I still want to get to what's making you anxious, what has you depressed, and see if we can try to do our best to remove that, because it doesn't have to be something that you live with. And we don't want to try to get you to just manage it so that it's a lifelong management. Maybe we can get to a place where it's extinguished out of your life and you're dealing with it in a different way.
Absolutely. One of the things that I did want to ask, since you mentioned diet, I'll take another question that says that some people live in food deserts, i.e. Ward 7, where I live and pastor, where there's mostly carry out and processed foods available, right? Not many fresh fruit and vegetables and those sorts of things. What is the connection, if any, between diet and mental health? Who'd like to take that?
I can talk about it as I have my kitchen behind me, as it is.
Absolutely. I was going to call on you, but especially if you had something cooking back there.
Right. Now, this kitchen is also a food desert. I was going to say, I keep a little something in here. I keep a little profile, but at the same time, what I wanted to say to that is your gut is your second brain. And I think people don't realize that, like, whatever you put into that gut, your body is going to react to that. So if that's a lot of sugar, if that's a lot of salt, if you're putting in a lot of greasy foods, that has a major effect on your mood, your attitude, your disposition. And so it may feel good that you got that fried food in you. It feels good that you got a lot of that sugar in you, and it's taking your body up and down and kind of giving you adrenaline rushes, or just making you feel what we call comfort, right? But at the same time, the long-term effects behind that is not beautiful. And so we think about these food deserts where there are a lot of maybe carryouts or other alternatives. What I like is that sometimes you can find some of these food pantries, or you can find some of these places where you can get fresh food. But those disparities are real, and they are the challenges that we do face. And that's why it was so important that the schools were having lunchtime and mealtime, and where First Lady Michelle Obama was pushing for food programs, particularly for our kids, to make sure that they're eating healthy. But ultimately, what we have to do as Black communities, brown communities, and people of color is to push and say, we want these kinds of stores in our communities. That's one. We also have to be conscious and do our own due diligence to say, you know what, even if I have to go that extra block, or even if I have to say, hey, if you're going to be here on the corner store, why don't you have maybe some fresh food in here too? Maybe the community would also like that. But really, it does start with self-advocating. You have to make sure that you're putting the right food in your body. And if that means that you have to maybe go a little bit further to get it, it can make a difference on your generation and the next generation, because we see the impact of like diabetes and all these other chronic issues. So I'll stay with that.
Okay.
And I'll just do a
Go
quick
ahead.
echo to that too. And we do have gardening as part of our mental health programming, because we
Mm.
understand how important that is. Not just the fact of what we're eating. So how can we substitute herbs that have effects, lavender, rosemary, all these things that we know help with our overall health, but then also the activity of gardening and doing physical things that help with our our mental health as well. And again, what Dr. Span was saying, advocating and speaking up, is writing your council people, writing your executive county people, so they'll know what those needs are. They know. They just, unless they're held accountable, they're not gonna advocate for us the way we need to. And we talk about our elderly in the community, and what we've known that the civil rights generation, that they had to stand up. So I think there's still some more storytelling that needs to happen too, where we'll learn how to organize and learn how to really boycott and get the things that we need in our community for ourselves, and then definitely for the next generation.
All right. Well, we thank you for that. There's a great need for more master gardeners and all sorts of others in this season. And DC is one of the most beautiful places because of the fact that in each of the communities, not just in each ward, but in each of the communities, there are community gardens. And that's something, a underutilized resource that we have. And we have a land grant institution in UDC. So I just really encourage folk to hear that word regarding diet, hear the word regarding fresh fruit and vegetables. Change not only your mindset, but also change your eating habits as well. There's a question that has come up. Is there a differentiation between my faith walk and really needing to get help for my mental state? Am I negating my faith by not believing in God for that healing? I say absolutely, positively not. This is, we are spirit, soul, and body. And the spirit and soul are definitely connected, which you might say is something that we have to contend with as it relates to just who we are in terms of our emotional identity, etc. And so one of the things we must pay close attention to is spiritual health goes hand in hand with mental health. And I would ask that, our panelists would begin to share more of how these two are partners instead of enemies.
Well, how it's all partners is because when we think of the psyche, or even as Tyreek said, he likes being very historical, and I love going historical, and I'll go all the way back
Yes.
to about African perspectives and African identity as a diaspora, we always had it where the psyche, the mind, body, and soul was one. It wasn't until we started getting into more westernized ideals that it was separate. Like, this is over here and you're over here. You guys don't really talk to each other. And it's like, no, it's all one. It's a part of who you are. It's part of your wellness. And having the identity that it's all together, as Dr. Curry was already saying, that helps you to be more of an alignment, realizing that when I think about my wellness, I want to think about my spirituality and I want to think about my mental health. And I have the ability to work on them. And God's given me the ability to work on them and talk to people that have gotten the professional help to make sure that I can talk to them, as well as I have my pastor. So I'm hoping that you think about this as a community approach and that we're all here working together, as well as within your own body. Like it's all supposed to be aligned as much as it can be. So try not to sever them. That wasn't really the perspective or the ways that we had. And I'm hoping we can pull that back together.
Okay. Anybody else?
And the other part about that too, what's faith without wisdom? What's faith without works? And so you're just sitting around, if you're just sitting around waiting to be healed mentally, that's not the way this works. I love this story. I can't remember verbatim, but the woman who was stranded in a flood on her roof, and a boat comes by, and someone else wants to throw rope, and she says, no, I'm waiting for God to save me. God's gonna save me. And then a helicopter comes by, and I'm waiting for God to save me, and then she dies, gets up to God, and God, she says, what happened? God said, I sent all these people for you. Why didn't you take them? And so you're sitting around, believing that your faith will be questioned if you're asking for help. No, that is part of the faith. Trusting that, God is sending someone there to you to help you in whatever way that you need. It's not about just sitting and waiting. It's sitting and actually reaching out.
And I'm indeed grateful for that. Our church, Pennsylvania Avenue Baptist, partners with MBI Health Services, and we have folk that come in that have all varying degrees of mental health challenges, but they are generally from the community. If they're not from the immediate community, Ward 7 and 8, then they're from some other place in DC. And operating at this nexus between what we see as church and community and what is happening with those in community helps bring the community together. And I'm indeed grateful for you all sharing that. These two things are not mutually exclusive, but actually part of a community, to quote Dr. Spann, and a team approach so that we can bring this stuff together. Let me ask a more specific question, if you could. Go ahead, Ms. Anderson.
I'm sorry, real quick. I just want to say I'm a Christian and I go to therapy, and I think a lot of times we think as therapy is just in crisis mode, but we also got to think about preventative mode as well, right? So just like you wouldn't wait 3 years to go to your primary care physician, you get physicals every year. I really think you should check in with a mental health therapist every year as well. That way you can see signs that are coming up at least. And then when there is a heightened sense of urgency, then you can structure that. And then it also helps with what you're praying for, right? So if you think you are having an issue with, if that's financial, that's really, anxiety or family issues, then you're focusing your prayers on the wrong thing. So how do you redirect and get those tools that you need to really begin to focus your attention on the right things? And so the same thing, how you go to a doctor, again, you're going to a doctor who has trained, most of their lives on learning how to practice on your body, learning how to heal your body. The same thing with clinicians and therapists. They have spent, a lot of years learning this practice, which is why, I really sought out Tariq to come in to bring it, because there's a lot of people having mental health conversations, but unless you have a therapist there, you're going to be having this circle of conversation. So how do you begin to move forward and to get strategies in coping and healing? And that is, again, collective work. And again, there's church, there's faith, there's therapists, there's family, there's community, there's friends, there's all those things that play a part.
Oh, I think that just that really nails it, and I'm grateful, because I do understand. I'm a pastor. I have a pastor, but I also have seen therapists as well. So understand that in life there are some things that one has to contend to deal with, and we want to, personally, as a believer, as a Christian, I believe that Jesus was the most self-differentiated person in human history, with the ability to have clarity with regard to his mission and with regard to his emotional and mental and spiritual health. So I'm definitely looking to have those in Facebook land and other places that are watching this telecast really find themselves reaching out to these therapists and these folk who are in community. I do want to take maybe a couple of additional questions before we get off of here. And this one is sort of a personal one in nature, but I think it speaks to what is happening with this whole COVID experience. I know to some degree I've experienced this myself. The person writes, until recently, I would sleep soundly 6 to 7 hours a night before waking. Now it's no more than 3 hours. Then I seem to wake up every hour or so. What should I try to remedy this? I'm seeing a difference in my focus and in my attention span. Can you really share with us what's happening? You know, why are we more restless? What's going on with us? Is there a model we can begin to follow to sort of remedy this? Dr. Span?
Yeah, there's definitely so. So the beauty of during the social distancing, which has been different from other pandemics like the Spanish flu, is that we have a lot of technology now. And so I've talked to people and they're like, yeah, I've been on like 6 or 8 Zoom meetings and I've gone to a Zoom happy hour. And then I'm staying up to like 11 o'clock at night, 12 o'clock at night, right, watching Netflix because I got to catch up on that show that I haven't been catching up on. And then it's like, I can't sleep though. And I'm like, you know why? Because your brain's getting all this image and it's still processing all that electronics and light and stimulation. And so you may be thrown off a little bit with how you have your circadian rhythm. So that's one, electronics have really impacted our lives. And so what I would say is you can start to practice now, not now, but after this webinar, turn off the electronics, right?
Right.
Turn off the electronics, get some me time, get some quiet time, because you have to give your brain so much time to quiet down so that it can get its most restful sleep. But because this is one of our best ways to connect, we're on electronics a lot. So think about that. The other thing is that we're not as active. So we're not really getting the opportunity to wear our bodies out. Now, I would say do some exercises in your house, but we don't want a whole bunch of home injuries. So just be careful as you're exercising. Maybe you can find that small space where you can get outside and get grounded to nature and allow that opportunity. Other thing is back to the food. A lot of those crazy foods we eating up late at night, eating these starches and these pastas because we can, and we know we don't have to go to work. So we're throwing all these weird things into our body and just like, I'm just going to have a one big vacation. Be careful of that as well. But so those are my things, are like just how we're doing. And so I can't get really into the tangible of the story because I don't know all the nuances. So I can't explain exactly what you need to do. But in general, these are some of my ideas. And maybe Tariq or Ms. Anderson has some other stuff.
I would say also, check your schedule. That's one thing about us at home now. Our schedules are off. For me, I know for me for a while, I was getting up 7, 8 o'clock when I typically get up at 5 o'clock. So my whole system was thrown off. That affected my motivation, that affected my focus, that affected my rhythm throughout the entire day. And so now I've had to force myself to get back on the schedule. I have to force myself to get to bed by 10 o'clock, 11 o'clock, so I can get up at 6 o'clock and just get my day started. And so you want to make sure that the things that you were doing before this, you want to carry some of that over into your present day. So if you were on a stricter schedule before, try and get back on your schedule. Like Dr. Span said, if you exercise normally, you want to continue to exercise. Your body needs to be physically tired as well as your mind. I agree with Dr. Span all the way too, in terms of cutting back on the electronics and how this affects your brain. But some of the things that you can also do is, with my clients, I'm primarily a couples therapist, but I do a lot of mindfulness work with my clients. And so meditating is major, so taking the time to slow your brain down, meditate, before you go to bed, meditate when you first wake up in the morning. And if you don't know how to meditate, there's videos out there to help you, or reach out to a meditation specialist. Do other mindfulness activities like body scans. We like just looking at every part of your body and making sure that you're in tune with your own body. Instead of watching a TV before you go to bed, pick up a book and read. That gives you a chance to get away from the electronics and the screens and how it plays with your brain. And just actually having something in your hand and reading a book, which can also help you focus and to slow down a little bit. And that's the other thing about meditation too. It really helps you to center yourself and also focus a lot better too. So meditation is always good. Doing a body scan and reading. Those are my top three suggestions for getting your body back onto a more normal and fixed schedule.
And I'll just share my personal experience. I'm not a clinician, so I'll just share what has happened to me and why I reached out for help with the help of my mom too. So I hadn't been sleeping, but there's a lot of anxiety, right? So you have this pandemic, you have whatever anxiety that you had before layered with this pandemic. And really talking to a therapist kind of really helping me pinpoint what was the source of those anxieties was really helpful. And then coming up with a plan to tackle those things. So I'm not sure what this person's situation is, but if there's something causing you anxiety, to try to get to the root of what that is, and then create a plan to tackle the things that's causing you the most anxiety first, just so you can get that weight off your shoulder. And that typically helps with your body, like getting out of defense mode as well.
Yeah. Thank you so much. I being a contemplative, I frequently meditate. And matter of fact, we even have meditation Mondays at a class that we share at our church. It's faith based. It's rooted in our Christian belief. But the notion of silence and the notion of quiet, some will say that those not 21st century words. So I thank you for sharing that, because most of us are really suffer from what they call an Eastern thought monkey mind, where our mind goes from thing to thing to thing to thing to thing, back to thing and back to the other thing. And so this period in time has been a period where God has called us to slow down and in fact stop and begin to understand, our totality of our being. And I thank you all for sharing on this full expression of the real impact of remaining and staying mentally fit during a COVID-19 pandemic that we're experiencing. And I hope some of the practices and some of the teachings that you all have shared will lead, guide, and direct those who are in the audience and those who are watching this on Facebook Live and other social media outlets to really examine yourselves and really understand that you have an opportunity to remain healthy and fit. Pick up a book, pick up the Bible, pick up something that will help you. Go see a therapist. And I would just like each of those who have been with us on our panels to provide your information one more time, and at least just state your information so that they may catch it in the broadcast, and they may be able to write it down so that they can contact you. So feel free to share your contact information and a final thought, if you would, please.
Okay, if you want to find me, it's very simple. You can go to my website, insightm as in Mary, ft.com. That's insightmft.com. You'll find my offices as well. I'm actually located, I have 2 offices, one in Largo and another one in Silver Spring. That doesn't matter right now because we're just doing telehealth to keep everybody safe. But that's where you'll be able to find me. You can find how to contact me from there. In closing, remember that you have people out there who are not being very careful. And so you want to make sure that you're being mindful of who's around you, what they're doing, what their intentions are, and doing everything you can do to keep yourself safe so that you can keep others safe as well.
Ms. Anderson?
Yes, so you can find us at startingwithtoday.org. We are on most social media platforms at Starting With Today. Our email is info@startingwithtoday.org. So feel free to send us email, send us a direct message or whatever, and however we can assist, we will. I think this is a great conversation, and comes to the point that was spoken about earlier. We have to begin to normalize these conversations. One of our things is about our stories, our spaces, and a lot of times we go with the mental health piece, but we can talk about our stories, and then that we begin to share and we get to heal and we begin to find pieces of ourselves that need addressing and bring clarity to our purpose and to our path, and so we can get more intentional about where we're going.
Just in case there are those that don't have email or a website, because we do suffer from a digital divide
You're
somewhat.
correct. They
Are,
can,
are,
they can
how
call
can
us.
we contact you all in a business setting?
You can contact us as well via phone at 240-718-4798. Again, that's 240-718-4798. If you don't get an answer, just leave a message, and we're pretty good with responding within 24 hours.
All right.
And some of the phone numbers, you can reach me at 240-542-8545. Again, that's 240-542-8545.
All right. Thank you. And Dr. Spann, close us out.
Well, I want to say it's been an honor and a pleasure to be here. And I think everything that was just said was right on time for thinking about mental health and wellness, and particularly within our communities. I want to say that Dr. Barbara Sizemore, who was really influential in the school systems and thinking about Black people, would say for a Black community to move forward generationally, we have to be healthy from within, and we have to think about how to heal from within. And so as we're talking about this for this current pandemic, this goes beyond that. This conversation about healing from within, spiritually healing from within, mentally healing within, physically healing from within. So that's the entire psyche. We have to do that to move generationally forward, to give to the next generation a healthy chance. And so I say that to say that I appreciate this conversation. This is how we culture shift. And that's what we're doing at Henry Health in talking about culture first and culture shifting. So there was a question like, well, is there a call line or a wellness line that I can contact where I can have those calls? And we do that at Henry Health. So if you do check out our website, it's www.henry-health.com. If you go to our website, we have lots of resources. You can sign up for free consultations so that you can connect with a therapist like me that is culturally intentional and responsive. We also have it where if you, as I was saying, the wellness call doesn't have to be for you. It could be for a loved one nationwide. Send them there to that as a resource, and we're here for them. And we are providing teletherapy. And that's something that we have tons of therapists now, because it is, everybody's, as Tyreek was saying, is virtual, so there's tons of people that are virtual, and we want to support you in that. And last but not least, our number is 724-250-8855. And again, that's 724-250-8855. I had to look that up for a second. I was like, ooh, I haven't heard the number in a while. But yeah, so that is our number. I can also put it into the chat. I was doing that, but then Stokes, one of our chief strategic officers, she put that up and helping me out. But I want to say this has been a pleasure, and I hope that you guys do use the resources that are here for you.
Well, I'm just so excited, and hopefully we can circle back with you all at some point in time, perhaps before this is over, or perhaps even when we move into post-pandemic era and once we get reopened society. But I am just so grateful, excited. I think this is a blessing from God. I thank God for each and every one of you, and I'm just grateful that we've been able to pull this together through the Pennsylvania Avenue Baptist Church and the Rodham Institute with Dr. Gigi and GW, George Washington University, and all of the staff and all of those that are there. I just say thank you, because this is really impacting a community in ways like never before. So thank you so very much for joining with us, and we look forward to everything that you're doing. Thank you, Henry Health. Thank you, staying with starting with today. And thank you, Brother Tyreek, and all of those that I've spoken with in and around. I'm so grateful to all of our panelists. I wish we could give you a round of applause, and because you were just so excellent. Thank you, thank you, thank you. And
Thank you,
may God
Dr. Curry,
bless
for
you.
having us.
Thank you.
Yes.
Thank you so much for this opportunity.
Oh, you're more than welcome. So we're grateful and we look forward to talking with you soon. Be well.
All right.
Thank